The fitness industry makes more money when you're confused, injured, or chasing the trends. Why no pain, no gain is BS. It's foolish. The three mistakes 72% of people do that lead to injury. Why your fitness routine might actually be toxic, and the scientifically backed way to actually get fit, right? Because that you guys want to know that, right? You guys want to know, how do we get fit? All right, so there are people out here doing terrible squats. There's people fainting in gyms, people struggling to finish a HIIT class, and then y'all ended up in the emergency room. Every single day, I'm reading about or taking care of patients who are absolutely killing themselves in the gym because they're doing it incorrectly. Bad form, overtraining, acting like pain ain't pain, no pain, no gain, whatever that BS is. And the industry of fitness is 100% okay with it, right? Because they are making millions of y'all telling y'all that this is normal. Like this is just the way that it's supposed to go, right? You're supposed to be hurt. You're supposed to be like your joints out of whack. Like this is supposed to happen. And I've taken care of quite a few patients who've had injuries that have caused them not to be able to go to the gym for months, right? Because they didn't do it appropriately, right? So if y'all know, I don't know if y'all know, right? Don't know if y'all know this, right? ER visits, right, account for from exercise injuries are up 48% in the past 15 years. I want y'all to think about that. ER visits due to exercise injuries are up almost 48% in the past decade and a half. Most of them are preventable. Most of them y'all should not be getting yourselves in the position that y'all in, but y'all done saw something on TikTok or Instagram and they said, hey, you got to exercise this way. They didn't tell you all of the do's, and they told you the do's. They didn't tell you the don'ts. And because they didn't tell you the don'ts, y'all end up doing all of the don'ts and end up getting yourself hurt, right? So today we're going to talk about a lot of the mistakes that y'all are making when y'all get to the gym, right? Now, mind you, this is not an episode that says don't go to the gym. I need y'all in the gym, right? Y'all know who y'all are, right? Everyone should be in the gym one way, shape, or form, right? Like fit, not fit, like, but y'all know who should be in the gym. Right? I don't need to be explicit and say who needs to be in the gym. But just because I need y'all in the gym does not mean I need y'all to do stuff that is going to cause y'all to be hurt and then end up, right, not being able to go to the gym for months, right? Like I don't want that, right? So we're going to talk about that again. Remember, yours truly, Dr. Barry Pierre, board certified fraternist, host of Medicine Mondays, right, and author Your Health, Your Choice, Your Future. Book is available now for your reading pleasure. I think we have to talk about this aspect of, exercise, right? And how all exercise, right? Like they just want you to just go exercise, right? Like you guys would not go and do a job without some type of proper training, right? You guys wouldn't just go and do a job without some type of proper training, but you guys are running to the gym with all these heavy equipment and y'all are just watching people do things. And you're like, oh, I'm going to do that too. Right. And then you end up getting yourselves in trouble. Right. So again, let's talk about this. Let's talk about let's talk about my gym rats. Right. Like, for example, like these bike machines. Right. Very, very popular. Right. To be on these bike machines. And there are some people who will deal with kind of lower back pain, lower sacral pain. Right. And just try to quote unquote fight through it. Right. Because they have to be on the bike machine. Right. Like, and they'll do that for months, right? And just fight through it to the point where now they can't even sit down appropriately, right? Because their butt hurts so much, right? And more importantly, the coccyx bone hurts so much, right? Which is a very common injury for those who are on bikes a lot, right? Who do bike machines a lot, because all that pressure you're putting on the coccyx bone, right? But again, it's one of those things where like, hey, I didn't know, right? And that's where we talk about this, listening to our bodies. I didn't listen to my body. Because I didn't listen to my body, guess what? I ended up hurting myself. So now I can't do the bike machine for like 2 months until I feel better, right? I don't want that for y'all, right? We don't want that for y'all, right? So we want to make sure, right, when we talk about, right, and like I said, we got some things to talk about today, right? The number one exercise mistake that are killing y'all joints, right? The number one exercise mistake killing your joints. Why your fitness routine might actually be toxic. Why your fitness routine might actually be toxic, and the scientifically backed way to actually get fit, right? Because that you guys want to know that, right? You guys want to know, how do we get fit, right? This is what this whole month's about. How do we get fit, right? And we talked about diet last week. What to do, what not to do. Right now, we're talking about exercise, right? Because I know it's important. I'm not telling you it's not important. I'd be lying if I say you shouldn't be. That's a lie. No, we want y'all to exercise, so we just want y'all to do it correctly. We just want y'all to do it correctly. Again, let's break down. These are things I want to break down. Why no pain, no gain is BS. It's foolish. The 3 mistakes 72% of people do that lead to injury. 70%, over 70% of y'all are doing this thing that's leading y'all to injury. What's real, what's safe, right? And more importantly, how do I build a successful, sustainable exercise regimen for life, right? Like that's what it is, right? Because again, I just want y'all to avoid injury. I want y'all to avoid injury. In my book, I talk about a patient of mine who was this gym rat, big gym rat, right? Couldn't tell him nothing. He stayed in the gym. But in that, he used to do a lot of hormone replacement things and things that, steroids and testosterone, all these things here, right? Because he wanted to be in the gym, and he ended up becoming hurt. And the book actually talks about him actually having a heart attack, but like I said, I took care of him for a while. He ended up getting hurt one time because his joints were so brittle, right? His joints were so brittle, right? Because of all of the exogenous medications that he was taking, right? So again, like even the gym rats, even there's problem even in the gym rat industry, right? Shout out to the fitness folks, right? I'm not telling y'all, I don't want no fitness folks on my comments saying like, oh my God, Dr. Pierre's trying to get people not to go to the gym. Definitely not the case, because I go to the gym at least 3 to 4 times a week, right? Because that's not the case here, right? But we have to talk about what's important to make sure that my patients or patients who are watching this or listening to this or their friends and family can go to the gym and know that it's a safe space for them and they won't end up in the hospital. Here's some reality, right? Here's a reality. It's, this is a capitalistic world we live in, y'all. Y'all already know about that. We talked last week about the $70 billion industry just for diet, right? So let's talk about the fitness industry. Fitness industry makes more money. Again, just hit the notification bell and the likes and the subscribe if you're not already have done so. If this sounds familiar, the fitness industry makes more money when you're confused, injured, or chasing the trends. The amount of industries that are baked into the fact that if this person's confused, they'll spend more. If this person is not their best health, they'll spend more. Hey, if we cause this trend to get like virally, like they'll do it, right? And then they'll end up spending more, right? Like the amount of industries that are their foundation is making y'all be confused, right, is ridiculous, right? But again, supplement company profits if you think you need their product, right? Gym profits if you feel guilty about over committing and not getting into the membership, right? A lot of y'all will go and sign up for a gym membership knowing that you don't have the commitment to actually go to the gym. But in your eyes, as long as I signed up for the membership, that's okay. The gym folks know this, because the gym folks know that if everyone who is actually a member of their gym went at the same time, they could not fill it. Right? They're like, oh my God, there's too many people here. They understand that, right? So they're like, hey, you know what? We know that a lot of y'all are going to sign up and y'all not going to really come. So I don't have to worry about like space related issues because not y'all, even if we say everyone come to the gym at 12 o'clock, y'all not coming, right? They know that. And then this influencer, right? Who, shout out to the influencers, right? We love y'all. If you are on, and I know it depends on the algorithm. If you're on like TikTok, right? One of the biggest supplements that influencers go crazy for is creatine. And this is not a video to knock creatine. I'm not doing that, right? Because in fact, like if you go to my Amazon store, like I have a creatine supplement on there, right? Link in the show notes. So I'm not knocking that, but it's one of the most popular like supplements that are, and clearly it has to make money, right? Because it wouldn't be popular if it didn't make money, that are on TikTok, right? Like, so just so you can understand that, yes, like you can make money based off confusion. So a lot of y'all are out here taking these creatine gummies and have no clue what to do with them. No clue how to take them. No clue like if they're showing any benefit or not. Y'all just taking them because y'all seen 100 bunch of videos talk about creatine gummies, right? So shout out to the creatine gummy folks, right? Like I said, because I understand. Hey, marketing is marketing. Understanding that the incentive to tell you what really goes down and how it really works is not there. Be consistent, moderate movement beats, like this extreme training. Like, you don't need to, especially with my weightlifters, you don't have to do your max lift every single time, right? Like, just do it enough so that you're getting the appropriate motion there, and that's all it needs to be, right? But again, it is what it is, right? $35 billion industry, right? Remember, the diet was about 70 billion. The fitness industry is about $35 billion, and it's because they know that 70% of y'all don't even know what y'all doing, especially safety, right? They know that. Like, can you think about that? 70% of y'all, like 70%, right? 72% of adults don't know how to exercise safely, or not kind of safely or safely at all. Like, that was a survey done by the American Council of Exercise. Like, 70% of y'all don't know how to do it appropriately in a $35 billion industry that hopes that 70% continues to remain the same. And these are the results, right? And we talked about this. ER visits up 48% in the past 5 years. Overtraining syndrome, right? Typically, my folks who get that midlife crisis over the age of 40. Acute injuries from just terrible form and too heavy, right? Acute injuries, chronic inflammation from this push through, like, I gotta push through the pain mentality, right? So your joint, your hormones, heart disease, all these things can, like, kind of snowball into it, right? And again, what do they lead to? Long-term pain, like fear of movement. Like, you get to the point where I don't want to move anymore because it's so painful to move, and you don't move, you're depressed. Arthritis kicks in much earlier, right? So it is a serious issue, right? When we talk about the fitness industry and you guys not being adequately prepared, right, to do what you need to do in that industry safely, right? And unfortunately, it's financially beneficial for them that you guys are walking around confused, right? Like, but I don't want y'all to do that, right? Again, this is a big thing, right? Why do people fall for the no pain, no gain, right? Like, this is something where, like, I don't know if this was TV. I'm pretty sure some marketing genius told us that if you're not feeling the discomfort, right? If you're not feeling discomfort, then you're not doing enough, right? And yes, there is some truth to that, right? Like, if you can lift 50 pounds, right, but you pick up weights that are 5 pounds, you might not get the the level of benefit from it if you're only lifting 5 pounds, right? So yes, you may have to go to 20 pounds, right? But just because you can lift 50 pounds, if you can't do it with the appropriate form, it does not matter. Maybe you can lift 50 pounds, but instead of, doing it appropriately and, isolating the right muscles, right, you got your whole back into it, your foot, you're swinging your arm. I don't know, right? Like, it just is, like, I'm sure, like, if we actually made you do the correct form, right, which is why, right, and I'm a big promoter of getting the experts where the experts are, right? Like, a lot of people think that personal trainers aren't important because, I can just Google this thing. I can just chat GPT this thing. Like, a lot of y'all are running to AI, which, again, AI is beautiful, right? A lot of y'all are running to AI thinking AI can do everything for you, right? I like getting the experts where the experts are, right? And in exercise and working out, guess who's an expert? The personal trainers, right? They will get you right. They will get you making sure that you got the right motion, you got the right weight, you got the right form, and you can avoid seeing me in the hospital, right? So again, a plug in for all of my personal trainers, because I know exactly just how important it is, right, to get you to where you need to get to, right, in regards to the goal of being as physically fit as you need to be. All right, so let's talk about some of the mistakes and solutions that we need to do to help prosper next time we go to the gym, right? Number one mistake is overtraining, right? A lot of y'all are overtraining again, right? Because you guys think that, like, I just need to keep pushing my muscles through it, right? Your muscles be screaming for a day break, and you're like, no, I got to hit biceps again. I got to hit legs again, right? Whatever the thing is, right? A lot of y'all are overtraining, right? And study from the University of Melbourne show that the rest days aren't laziness. That's when adaptation happens, right? That means when your muscles get used to, like, okay, like, all right, I wasn't ready for 50 pounds then. I'm ready for 50 pounds now because I got the rest. You guys won't allow the rest to occur, the adaptation to occur, so you never ever get ready for the 50 pounds. Because by the time you come back around, your body's like, man, I'm still tired from dealing with the first 50. Like, I can't deal with this, right? So guess what? Instead of you dealing with 50, now you can only deal with 40. right? Because your body's like, man, you're like, leave me alone, right? So understand that you have to give your body rest when you're exercising, whatever you're exercising, how often you're exercising. You got to give that body rest. Rest days are just as important as the days you're working out. Now, unfortunately, a lot of y'all got a lot of rest days in between your exercise days. We don't want that. We don't want a lot of rest days. Your body don't need that much rest. Your body does not need that much rest, right? Shorten it up, right? At least 2 to 3 rest days a week for sure. When you're exercising. Number 2, poor form. I think that's self-explanatory. A lot of y'all have terrible form that got y'all joints out of whack, right? And, and because you do that, right? Like you think, right? Like, oh, I could do 100 squats. And then someone who knows how to do 100 squats, like, oh, you're not going low enough, right? You're not bending your back, or you're not doing what you need to do. And then when they show it to you, all of a sudden those 100 squats turn to 50. Right. So you, in your mind, you told yourself I could do 100 squats until someone showed you exactly how to do those squats. And now you can only do 50. Right. It's like, so understand, like, poor. So imagine if you would have carried on trying to do the 100, eventually you would have hurt yourself because your poor form would eventually caught up to you. Number 3, ignoring the pain. A lot of y'all are just acting like, again, y'all are living by this no pain, no gain, and your body is screaming. Again, remember, we got to trust our body. Your body is screaming at you to slow down, sir, ma'am, slow down. Like, this hurts. Like, this shouldn't hurt as much, right? And that goes back to having poor form, right? That goes back to overtraining, right? Like, it just, again, these things just start, kind of snowballing. And a big one as well, you don't personalize your workout to you. You saw Joe Blow over there doing an exercise. Oh, Joe Blow doing an exercise. Oh, I'm gonna go do that too. You don't know why Joe Blow's doing that. You don't know how Joe Blow has trained themselves to get to that point to do that type of exercise. You all of a sudden going to want to go do it because you saw it on TikTok or Twitter or Instagram, right? Like, and then this is a big one. We talk about this, neglecting recovery, right? Again, recovery in you guys' eyes is optional. That is false. Recovery is mandatory. You need the rest days. You need to adaptation, right? So trying to avoid it, right? So that's, again, it is like, we gotta put our thinking caps on. Got to put our thinking caps on when we're worrying about getting ourselves to that next level, especially in the gym, right? So you got to avoid these mistakes. You got to avoid mistakes. But one mistake I don't want you to avoid is making sure you are subscribed to the channel, making sure you hit that notification bell, right? Make sure you share this video out to 10 of your little exercise friends and say, hey, Dr. Pierce says I need to get myself together. And these are the common mistakes that I'm running into when I'm trying to work myself in the gym, because I'm trying to avoid being one of the 48% of people who end up in the gym, right? So let's talk about the solution. Let's talk about what works, right? So number 1, right? Let's talk about what actually works, right? Again, you got to have that cardio. I know a lot of y'all like hate cardio. You got to have cardio. Cardio is extremely important. They recommend about 150 minutes a week of cardio, right? So again, however you get it, right? Especially because a lot of y'all jobs got y'all sitting all day. A lot of y'all jobs, if they put one of those watches that kind of mark your steps, a lot of y'all not getting 10,000 steps a day, 5,000 steps a day, right? Because you sit to your chair and then you just couch out for about 8 hours, and then you go back home in a car, go to your house, in a couch. Like, y'all are not getting y'all steps. So moderate cardio, strength training, you got to have it, right? You got to have it, right? And I can assure you, right, especially for my ladies, I can assure you, you're not going to be, especially if you're afraid of being bulked, right? You're not going to be bulked just because you add some exercise with some strength training to your sessions, right? So please, like, stop playing games. Again, remember, recovery. Always got to have the recovery, right? So again, 150 minutes of cardio a week, at least 2 days of strength training. Again, I know a lot of people do a lot more, right? But you need at least 2 days for sure, and making sure you're having your recovery, right? Like, you got to have it, right? You got to have your recovery, right? So before we get out of here, right, y'all know this month, right? This month we've been doing some challenges to try to get us together, right? Because again, I know January that came and went, New Year's resolutions that came and went. We got some challenges to do today. So number 1, get a baseline for you, right? So number 1, I like this, right? So your first week, I want you to assess yourself, record yourself, or someone recording yourself, just so you can kind of see. Like, and again, it don't have to be like video recording, sure, but at least just keep a mental check. Maybe write some notes on your cell phone. Say, hey, all right, I did this exercise here. Like, this is how much I can get to. This is how much I can push to, right? Get a baseline of what you can do and what you cannot do. Number 2, get your form together, right? So week 1 is about getting your baseline. Week 2 is about getting a proper form together, right? So you can get to it, right? Because I don't want you to jump up to weights and exercise. Like, no. I want you to, especially for those who have not been to the gym, right? Especially my new gymmers, right? Like, you're about to go to the gym after you watch this video, right? Spend that first week just understanding what the gym is like, where the weights are, where the exercise machines are, like just getting that idea down, right? And then week 2, we work on a proper form. We're working on the proper form so we don't hurt ourselves, right? And then obviously, number 3, we start adding that consistency. So now I'm going to gym twice a week, 3 times, whatever the time is, I'm just going consistently, right? Because I want to get to it, right? Getting your consistency together. And then once you have that down, once you have your, that's our system, right? We're building our system from one strength movement down to another, right? Some people do a push-pull method. Some people will focus on like, all right, I'm doing biceps and back. And some people, I'm going to do chest, triceps, and shoulder. Whatever your system is, get you a system down. Again, obviously, right? If you need to, get yourself, if you can, right, get a personal trainer, because I know personal trainers cost money, right? Get you a personal trainer, but document everything. Got to document everything, right? Especially for my new gymmers, and especially my new dieters. If you watched last week's episode, you want to take your before picture, right? Because a lot of times the results don't show up on the scale immediately. The results may not show up on the scale immediately, right? But the process is there. The form is there. The behavioral changes is there, right? Because remember, y'all done spent decades avoiding the gym. Y'all done spent decades being overweight. It ain't going to happen after 1 week. Like, y'all not turning a corner after 1 week. Like, stop it. Like, y'all, I need y'all to like relax, right? Remember the goal of this, right, is to feel less pain, sleep better, look better, have more energy, right, and avoid seeing me in the emergency room, right? That's what I want you to do, right? Avoid seeing you're truly in the emergency room, because you're doing what you need to do to make sure you are attacking the gym appropriately and not feeding into this system that's $35 billion up, based on the fact that you are confused and you're going to be hurt, right? And then you're just going to have to do it all over again, right? So again, yours truly, Dr. Barry Pierre. I'm going to see you guys next week.